Welcome back to the YouTube channel. My name is Rafael. I'm an emergency room nurse and combat veteran, and today I'm going to talk about how to deal with the death of a patient. So when the worst case scenario of your patient passing happens, there's a lot that goes through the psyche of the nurse, of the doctor, of the healthcare worker. The first thing that usually happens is guilt. We personally feel responsible for the patient dying, even though we know most of the times that it's inevitable and there's little we could do to start off with. We torment ourselves with all the things we could have done with this idea of 20/20 hindsight. But in reality, as a nurse, as a doctor, we hold so much on our shoulders and there's so many moving parts that it's really hard to think in this perfect cookie cutter world of what we could have done to save the patient. And so I want to give you a couple tips and mindset hacks to really help you process this experience. The first thing is, easier said than done, do not blame yourself. I know this is really hard to do, and why I teach so much meditation and somatic techniques, what I'll show you later in this video, is to help you ground into the moment. Because the nature of the mind, specifically after experiencing something traumatic like death, is to replay the situation. The second thing I'm going to recommend to you to help process the death of a patient is to take time for yourself. We can easily distract ourselves, push it away, but if we don't deal with this trauma, with this experience that we have within us, it's only going to continue to bother us and come to the surface in other ways. The third tip I have for you for dealing with a patient death is not to self-medicate. It's very easy to go to the bar, have a couple of drinks, smoke a joint or whatever your self-medication, method be, binge TV, but really you have to sit with the experience and process the emotion. So now that we have these three ideas of how we can help deal with death, I want to give you three specific techniques you could use to help physiologically calm the body. So, little overview of trauma. When the body experiences something difficult, the tendency is to hold tension in the body. Cortisol levels rise, adrenaline rises. This is usually what's happening during a code within the body. This is the body's fight or flight response. And when we're holding this tension and we don't do anything about it, it stays in the body. Specifically in the psoas muscle, towards the stomach and the back. This is an area that really holds onto that tension into the shoulders and into the neck. Over time, these symptoms really wreak havoc on our mind. So these techniques I'm going to show you are really good to release trauma, to release stress. The first technique is called progressive muscle relaxation. And you might have done this before, but I cannot stress how important it is to relax the body in terms of dealing with trauma. So, like I said, when you're dealing with that trauma, you're holding all this tension. So what we need to do is reset the nervous system. So the way we do this is we turn all the muscles online, contract 100% as tight as possible, and then fully relax the muscles so they can calm down. Because when people are holding on to stress and anxiety, the muscle contraction is about naturally at a 20%, and who wants to be walking around this wound up tight person? So to practice this technique, you're going to inhale through the nose, you're going to squeeze the shoulder, you're going to squeeze the hand, you're going to close the eyes as if you ate a sour lemon. You're going to really hold every muscle in the body, including the toes. Hold, squeeze the biceps, hold, 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 hold. And then release completely. Take a few deep grounding breaths. So one more time, you're going to inhale, squeeze, furrow the nose, the toes. Hold all that muscle tension, squeeze, turn all the muscles 100% online. Release. When you practice this, you're sending signals to the body and to the mind to chill the hell out. That the situation has passed and you can let go of all those neurotransmitters you're holding on to, all that stress, all that cortisol, all that adrenaline. So that's the first technique, really helpful. Second technique is shaking. If we look to the animal kingdom, when let's say a gazelle is running away from a lion and it reaches safety, If you notice, if you ever watch Discovery Kingdom or have heard about it, the thing that the animal does is it shakes. It literally releases the tension out of the body because, again, cortisol, adrenaline, all these neurotransmitters that are coming into the body during this fight or flight experience have flooded the system, overloaded it. And shaking is a way of releasing excess tension. So when you're in a code and a patient dies and you're dealing with the aftermath of maybe family members screaming, of all the chaos that's coming on, performing in the moment, all that stress, you're in that sense reliving that near-death experience, even though you're not. That's what's happening in the body, and we need to shake that energy out. So my recommendation to you, find a good shaking song. I can recommend a few in the video below, in the comments. And really, just for like maybe 2 minutes, close your blinds, put your headphones on, close your doors, do whatever you need to do to feel comfortable, and shake, release. It is actually a very intense experience at times if you completely let go. And you'll be surprised, sometimes you might cry, you might have a release, you might relive the experience, but this is all normal processes for really ridding the body of this tension. And it's such a powerful tool. This is something that we've done a lot in India when I practiced my training in meditation and breath work. And it's been the most powerful experience I can have from literally shaking. No drugs, no alcohol, nothing, just moving the body in its natural rhythm. And the third technique is grounding into the moment through the breath and through specific tapping of the body. Somatic techniques are very powerful to help us really come into their body, because when we experience trauma, there's a disconnect with the body because the mind doesn't want to experience the pain that is manifesting in the body. So here are a few exercises you can do to help you ground into the moment. In a future video, I'll do all of these techniques nicely packaged in maybe like a 20-minute video you can practice, but here's a quick breakdown. You can stimulate the space between the eyebrows, calming the area, really focusing on the sensation. You can come towards the temples here. This is really good for calming headaches, for releasing tension. Yawning is a very good technique you can do. Opening the shoulders up and back. Tapping onto the chest. This is one of my favorite ones. Just closing your eyes, feeling the sensations. And then this is also a great one with the fist closed. Tapping on the body in different areas, on the legs. This helps us come into our body and get out of our mind. Using these tools of shaking, of tapping on the body, on calming the breath, focusing on the exhalations longer than the inhalations to activate that parasympathetic nervous system, to calm the energy down. If you like this video, please subscribe to the channel, share this with your fellow healthcare workers, and above all else, just really try to work on yourself. I know it's hard. I know dealing with death is difficult. We've all gone through it in our careers, especially those of us who work in critical care, and it sucks. And there's a lot of self-judgment and a lot of pain associated with, but if we don't experience the healing process of facing the emotion, of allowing it to move through the body, it will plague us for life. And I don't want to scare you, because processing trauma is doable. If you just take this deeper inner introspective look and feel what needs to be felt, and learn to not take things to guilt personally. Again, we've all been there. I've been through over 100 deaths in my career in the ER, and yes, some of them might have been my fault. I could have done things better, but I really don't hold on to this guilt and this self-hatred because we're human, you know, especially if you're working in critical care. You know, shit hits the fan and it's hard, and we do our best, and all we can do is learn from our mistakes. So here are some tools. Use them. Don't hold on to guilt. Reach out to your community. Reach out to me. And I look forward to seeing you in another video shortly. See you guys next time.